Health officials have to be prepared to protect themselves even as they try to prevent diseases. This is according to the Chief Medical Officer of the Ministry of Health, Dr. Shamdeo Prasad. The CMO was speaking to Capital News at the launch of a workshop that focused on detection of disease outbreaks.
So who would really go out there and be at the front? How do they need to protect themselves also? Because one of the main observance and outbreak investigation and going out is that the health workers themselves are at risk. They go into environments that are risky, and many times health workers even get sick. Sometimes they even die if you follow outbreaks across the globe. So part of those is how to prepare well, to acquire all the knowledge, the background knowledge that you need to, when you go into the community, to be able to speak to the community, to talk with people, but also to come up with good solutions that are sound and, well tested.
Dr. Prasad noted the importance of gathering data to help tackle the problems.
Part of the challenge that we've had with identifying outbreaks and really putting our finger on the pulse, as it were, is the lack of sometimes collection of specimen, whether it's stool, sputum, urine, blood, whatever it is. A lot of times we have a difficulty, and particularly when it comes to stool, we would really like the public to understand that this is not, we're not making it difficult for you. And we know that you would like to go out and go to your health provider and quickly get a fix for if you have diarrhea or you're vomiting. But I think also being aware that the health provider will ask for a specimen is also very important, and that you're prepared to give that specimen.
Dr. Prasad also touched on the issue of typhoid fever, saying that the public must cooperate in order for there to be accurate diagnosis.
What we really need to do, if we suspect typhoid, is to have the stool examined. Usually what's required is a stool culture, and our laboratory can actually do that. So it's not a quick blood test and you do this test and say that you have typhoid. You really need to get it confirmed by taking a stool sample and have that culture done.
The workshop is run by the Ministry of Health in collaboration with the Pan American Health Organization and the Caribbean Epidemiology Center, CAREC. For Capital News, Roel Collins.